Just a comment, many of us may remember those salad days of 1995 and 1998 when help wanted signs were everywhere, when McDonald's was unsolicited offering $7.50 to flip hamburgers 14 years ago. And one way employers attracted the highest quality candidates was by having the best benefit package. It seems that that will be true again someday.
So I picked a question that is for Congressman Driehaus. It says, based on the House bill that has been marked up regarding health care reform, would you vote for it as proposed, or what major changes would you make so you could vote for the bill?
Well, again, there are 3 different versions of the bill. So I don't know what we will have to vote on. I can assure you that I will be looking very closely at universal coverage. That is, all people have insurance. I will be looking very closely at pre-existing conditions and coverage of pre-existing conditions. I will want to see in the bill savings that are driving down the cost of health care as a whole. I will want to see in the bill, I will want assurances that we are keeping the promise that is being made to businesses and individuals that if they want to keep their insurance, they can. And so I can't sit here and tell you, I can't speculate as to how I will vote on a bill when I don't have the bill in front of me, because we don't know what that's going to be yet. I think we would all like to see healthcare reform, and I have said that I want to support healthcare reform. But I think there are important things, and I mentioned the abortion issue as well. So there are things that make a difference to me when it comes to that legislation. There are differences to my constituents, and I will be looking at it very carefully and very thoughtfully. There are a couple other questions here. Have you already decided you will vote for a Democratic proposed health care plan? No, I haven't. I think the previous answer answers that. Why not a single-payer system like Canada's, which makes good care available to all? There are a lot of people that would prefer that we have a single-payer system. There are a lot of people in my caucus, the Democratic caucus in Congress, that would prefer that we have a single-payer system. And if you go out and talk to people who have been covered under a single-payer system, you'll hear mixed reviews. You will hear very good things about the universal coverage, about the access, and then you will hear different stories when it comes to some of the bigger procedures and the cost of those procedures, and in some cases the delays for the cost for those procedures. So there are mixed results. The reality in the United States is that there doesn't exist the public support, nor does there exist the political will to move forward on a single-payer plan. Both the leadership in Congress and the President have said that what we should come up with is a hybrid, a unique hybrid that will work in the United States, that functions for the United States. After all, what we're trying to do is come up with a system that serves the people of the United States. That's why 3200 was crafted the way it was crafted. Not as a single-payer system, but as a hybrid, one that offers a public option, but one that preserves what's best about the private payer system. So that's where we are.
So this question is testing my history a little bit. The question is, what presidents, both Republican and Democratic, have attempted health care reform and why? I think pretty much every president in the last 100 years or so has done something with health care reform. I know that there have been big efforts. President Truman was very strong on health care. President Nixon was very strong on health care reform. President Clinton was very strong on health care reform. President Johnson actually had Medicare pass, so very strong on health care reform. I think that health care reform has been something that this country's presidents have been attempting to improve, both Republican and Democratic, for the last 100 years plus. And it is something that we are still trying to improve today, because obviously it's unacceptable that 47 million Americans don't have health insurance, and so we will continue to fight, and President Obama is fighting very hard for health insurance reform.
death panels. There is a lot of misinformation about this bill, and this is one of the big ones. When I was up at University Hospital with Senator Brown, actually, a couple months ago, we had a very lengthy discussion with the hospital administrators about end-of-life care and the cost associated with end-of-life care. The hospitals estimate that 70 cents on the dollar in terms of their costs go to end-of-life care. The bill in the House would incentivize physicians to sit down with seniors to talk about living wills. Voluntarily, not mandatory, voluntarily to sit down and discuss living wills. Living wills, as you know, can say, I don't want extraordinary measures taken to keep me alive if I'm in that condition. They can also say, I want extraordinary measures taken to keep me alive. That's the whole idea behind a living will. The problem is too many Americans today simply put off decisions around end-of-life care, in which case we are spending a tremendous amount of money, oftentimes in the ICU. It may be at their will or against their will, but we don't really know because they haven't done a living will. I use the example of my father. My father passed away last fall. He had a chronic condition. He was dying. He had pulmonary fibrosis. He had a living will. We knew what his wishes were. But we knew that he was going to die within, weeks or months, or days in the fall of last year. I was there when he passed away. I don't know, had I called 911, if they could have resuscitated him, if they could have admitted him to ICU, if they could have tried to give him life support for another day or another couple of days. Maybe they could have. But he had a chronic condition and he was dying. And he knew that. And he wanted to go peacefully. However, oftentimes the choice is made to go in, and it is very expensive. We aren't denying anyone that choice. The idea is to at least allow them to make the choice. And I think we have to have an adult discussion around end-of-life care. It's a very difficult subject. But right now, physicians aren't reimbursed if they sit down and do counseling with families and work with families on these very difficult questions. They're reimbursed for the admission to the ICU, but they're not reimbursed to have the very difficult conversations around end-of-life care. That's what it's about.
My question is, since the federal government is broke, why can't we allow individuals under 65 who currently cannot afford health insurance buy into Medicare? My boss's position on this is that we should have early Medicare buy-in. He has long supported the idea of people being able to buy into Medicare earlier than age 65. Understanding that there are some financial issues with Medicare that we have to deal with, but I think it makes a very legitimate point. I mean, we have people in this country currently without health insurance who can't afford to buy it on their own, and it makes sense to allow them to buy into a health insurance system provided by our government. So I think we'd be supportive of that.
That concludes the questions for the evening. I want to thank all of you for being very cooperative with the rules, with the exception of those who left early. And, no ma'am.
Lisa said that we have to empty the hall at 9 o'clock.
Yeah, well, in any event, I want to thank you all for being here. And then we have one other quick thing that needs to happen. David will mention it to you.
We are a totally not-for-profit organization that exists by the charity and thoughtfulness of the people who attend our forums. We're going to pass some baskets through the audience right now and ask that if you would please reach into your wallets and purses and pockets and help us out. It costs us $700 to put the forum